Welcome to the GMH Discharge Planning Training for Physicians. GMH had 6 CMS citations under the conditional level deficiency. There was no criteria for discharge evaluations. There was no discharge planning needs assessment. There was no qualified discharge planning personnel. There was no documentation of evaluation. There was no implementation of a discharge plan and no reassessment of discharge planning. To address the citation for criteria for discharge evaluations, the Discharge Planning Committee has created high-risk criteria for discharge planning evaluation for each of the units in the hospital. You can click each unit to see each criteria. This is our discharge planning process. First, we have to identify our high-risk patients for discharge planning. High-risk patients are identified when the nurse completes an initial discharge assessment upon admission, or the patient or family support person expresses that he or she wants to participate in the discharge planning evaluation. Next, triggers from the assessments done in the EHR are sent to appropriate departments. Department staff visit the patient and family and assess the patient or family discharge issues. Next, the interdisciplinary and discharge team meets and discusses each high-risk patient. Case manager documents meeting and patient notes after this is done. Every patient is reassessed by nursing every shift for any new discharge issues. These issues are sent to appropriate departments afterwards. Discharge and follow-up. When the patient has discharge orders, discharge issues are addressed and resolved before patient goes home. When patient is discharged, social services will follow up with the patient within 7 days after discharge. If the patient has any clinical issues, the case manager will be informed and will contact the patient and family as well. Physicians should ask patient and family support people if they want to participate in discharge planning evaluation. If they don't want to participate, they have to make sure that they let the family know that they can ask for an evaluation at any time during their stay. Physicians should document all of these interactions in their progress notes. They also need to acknowledge the interdisciplinary team's meeting notes that are created after the team meets. Physicians are also encouraged to attend the interdisciplinary discharge weekly meetings or individual care conferences if possible. The interdisciplinary discharge planning meetings are scheduled weekly, and physicians may attend these meetings. Patients and support persons may request to be present in these meetings or schedule individual meetings. On Mondays at 9 o'clock, it's at ICU, 1300 Pediatrics, Tuesday 10 o'clock Telemetry, Wednesdays 10 o'clock Med-Surg, Thursdays 10:30 Surgical, Fridays 10 o'clock Nursery. To view the ICP documentation, you will find a patient, click on Assessment and Flow Sheets, click on Selection Properties, click Interdisciplinary Plan of Care Revised, click the View button. You should be able to see the ICP assessment. To order a discharge planning evaluation, you would select the patient, select Order Entry, make sure that you are the ordering physician. Under Order Panel, Find Discharge Planning Evaluation, select an order, click Submit, and click the green circle to complete. To acknowledge or create an interdisciplinary note, you would click Patient Notes and click Add, select a note type, or type in GMH. You can erase the template that's existing there and write down your recommendations or acknowledgement that you read the team note. Click the Submit button. You can scroll down to the Interdisciplinary Team Note, click the header, and click your note to view. To view an ICP team note, select a patient, click Patient Notes, scroll down to GMH Interdisciplinary Team Note, click the header, and click the note. You should see the note there. Just a few things to remember. GMH currently has only one case manager, but we are hiring more in the future. The effectiveness of the discharge planning program will be monitored by the Discharge Planning Committee. They will be measuring the readmission rates and analyzing reasons why patients have been readmitted. This concludes our training for discharge planning.